My name is Judy. I will be doing the subcutaneous injection today. Now with the subcutaneous injection, I need a helper to show the science. So I'm going to use my husband as my helper. And with the science that you can do, there is upper back that you can do a side on. And then there is the side and the back of the arm, which is kind of like the fatty part of the arm. And then you got your upper buttocks. With your upper buttocks, we want to call them the love handles sometimes, you know. And then you have the abdomen. But with the abdomen, you want to take 2 fingers and go 2 fingers around your belly button. And then from then out, you can do the injection. And then you can also do a subcutaneous injection on your upper thigh. But with your upper thigh, you go like with a straight line in the front of the thigh and then off to the side. And between those 2 lines, that's where you would give an injection. Thank you, baby.
You're welcome.
Now, with the subcutaneous injection, I will be doing my GPSP, my 11 rights. My 11 rights is for the right medication, the right patient, the right dose, the right route, the right time, for the right reason, the right assessment data, the right documentation, the right response, and they have the right to be taught, right teaching, and they have the right to refuse. Now, with my assessment data, when you give a subcutaneous shot, you will give it kind of like in a 90-degree angle. If it's somebody that, let's say, they're a skinny grandma, then they don't have much fat content. So you would give it kind of like in a 45-degree angle. But always make sure, pull the needle back out the way you put it in. Just want to make sure I got that one out of the way first. Okay, now I'm going to do my 3 checks. I'm going to pull my drawer out, get my medication, my insulin needle. And with this, I will be giving them an insulin shot in the abdomen. Did a glucose check earlier, and with the glucose check, it was 300. So I'm going to give him 10 units of insulin. Okay, so I am going to check the medication with the MAR. And then I'm going to check again the medication with the MAR, with the patient. And then I'll make sure that there is no expiration dates on the insulin or the needle, because it's very important to do that. And then I'm going to do my hand hygiene. I'm going to get my insulin ready, do my hand hygiene, and put my gloves on. Now with the insulin, let's say this is a new bottle. You don't have to clean the top of it because it is considered uncontaminated. Okay? So if it's contaminated, you will take an alcohol, you will clean the top of the vial off. Okay, I'm going to set you down. My husband's a lot taller. Okay, now we got you. So I'm going to take my needle out. Everything's been checked, dates are right and everything. Okay, I'm going to take my non-dominant hand, pull the cap off of the needle. And then I'm going to take the needle, only touching the tip of the plunger. I'll pull back 10 units of air. so that way I can inject it into the bottle. Help easier to draw the insulin out. Okay, I'm going to do it at a 90-degree angle. Insert it in. And take my non-dominant hand to stabilize the insulin and the needle. And then I'm going to draw, it's only touching the tip. I'm going to draw 10 units. Make sure 10 units out. Ten units out. Okay, that is 10 units right there. Take it out. Then insert it back into the cap till I get into the room. Okay, I will gather up all my stuff up. I will take my gloves off and go into the room with the patient. There's where I'll do my third check. I'll do my hand hygiene. I got all my equipment, go into the room. I'll do my hand hygiene again. And then I will check the patient's armband. Ask him his name, date of birth. I will check that with the MAR, with the medication. And make sure everything matches up. And then I will proceed to do the insulin shot. I will do my hand hygiene again because I had checked everything. And I'm going to give it to him in his abdomen. So I'll do my hand hygiene. I'm going to put my gloves on. I've already got my insulin drawn up. Everything is good. And I will be inserting it at a 90-degree angle because it has like a little bit of fatty tissue. So what I am going to do, I'm going to take an alcohol wipe and I'm going to prep the skin. I'm going to take and do from the inside out on the skin, never touching the same spot twice, so I'm not contaminating it. Dispose of the alcohol, let it air dry, and then I'm going to take my dominant hand and then hold the cap with the non-dominant hand and pull it out. And then I'm going to kind of push the skin up just a tad, just to give me a place to shoot. Then I'm going to shoot it in at a 90-degree angle. Slowly just hold the tip of it and kindly hold the needle still and shoot it in slowly. And then release. And if he has any bleeding, I'll give him a cotton ball. So if it's bleeding, and I will take and push my thing up on the needle and dispose of the needle as in the sharps container. I will take my gloves off, do my hand hygiene again. I make sure to do not rub the site. I do not press on it because it may displace the medication. So with that being said, I will go and do my documentation, document the medication, the site, and come back here shortly to make sure that there's no irritation of the skin. Make sure he's not having no side effects from an adverse reaction. Thank you.